His Excellency Othman Masood, the first Vice President of the Revolutionary Government of Zanzibar, Mama Anna Mkapa, Honorable Ministers, Permanent Secretaries, Member of Diplomatic Corps, representative from business community and non-state actors, distinguished panelists, ladies and gentlemen, good morning to you all. Courtesy demands I should start by thanking the Revolutionary Government of Zanzibar and the Government of the United Republic of Tanzania for the collaboration and support in making this symposium possible. My special thanks goes to His Excellency Dr. Hussein Ali Mwinyi, President of Zanzibar and the Chair of the Revolutionary Council, our settler, our host, and to all of you who came to join us today. I understand some of you were supposed to be on holidays, but you deferred your holidays only to be with us today. Thank you all. To you, our first Vice President of the Government of Zanzibar, we thank you for accepting to grace this event in midst of your demanding schedule ahead of you. We can't find words good enough to thank you and to say asante sana. Distinguished guests, 2 years without our beloved late His Excellency Benjamin William Mkapa has not been easy. His absence is largely felt as an ardent advocate and a formidable voice for reforms at home and peace abroad. Grieving, however, is not an option we chose. At the Benjamin Mkapa Foundation, we chose to step up and rise to the occasion. We vowed to continue where he ended, to amplify his voice and to sustain his legacy. It is the reason why we are hosting for the second time the Mkapa Legacy Symposium today and tomorrow. Distinguished guests, as a reformer, the late President Mkapa believed in partnership between public and private sector, PPP. He did not mince words on this, even when it made him sound unpopular at times. He is well remembered for introducing bold economic reforms, which translated into giving space for private sector to mushroom and grow. It was during his time, for the first time, the framework for the public-private partnership was introduced in Tanzania. He went further to establish the National Business Council as a platform for public and private sectors to interact and work together. Your Excellency, late President Mkapa's vision for public and private sector synergy is as relevant today as it was during his time in office. Taking an approach of the government doing it alone will take long to arrive to the universal health coverage targets by 2030. While working with private health providers will make the journey short, achievable, and impactful, instead of spreading thin, government resources will be optimized well by improving the quality of those facilities and services that exist, and focus on expanding services to those hard-to-reach areas where there's less incentives to attract the private sector investment. Needless to say, PPP is needed in the health sector to complement government efforts in delivering quality health services to the last mile. We have all witnessed that public-private sector partnership initiative spearheaded by the Ministry of Health of the United Republic of Tanzania and also the government of Zanzibar, with the private sector for profit and also with the non-for-profit. Nevertheless, we would wish to see more of those being further cultivated. Most times, such PPPs have been proven to be cost-effective, with high impact and highly efficient. This symposium is just about that, about how we can draw from such lessons and good practices and replicate them on other areas of health to achieve the universal health coverage targets by 2030. Your Excellency, distinguished guests, ladies and gentlemen, the partnership between Mkapa Foundation and the Government of the United Republic of Tanzania and the Revolutionary Government of Zanzibar is another demonstration and evidence that partnership works. The Mkapa Foundation continues to be a trusted partner of the government, development partners, private sector, civil society organization, and the community. As a result, we have achieved to reach almost 26 million people by various supported interventions by the Foundation. The model of PPP implemented by the Mkapa Foundation in the last 16 years has registered remarkable public health outcomes. The few areas which I would like to underscore is on human resource for health. The foundation has been actively engaged in providing technical advice and supporting human resource for health initiatives through the Ministry of Health and the regional administration and local government authorities, as well as President Office Public Service Management. We have effectively co-developed a country human resource for health programs, several of those for bilateral and multilateral partner financing. Through such programs, we innovatively employed more than 10,000 health workers that have been deployed to health facilities and communities, of which between 50 to 80% of them have been transitioned to the government employment system as from 2012 to 2022. Together, we devised cost-effective continuous professional education among health workers through digital modalities, whereas almost 34,000 healthcare workers have been trained and 11,500 healthcare workers are currently undergoing various training using this e-learning platform. Your Excellency, BMF's partnership with the government is not limited to projects and downstream interventions. We partner through the World Structured Policy Dialogues platform led by the government, and here in particular the Ministry of Health. We have contributed to the development of various policy guidelines and strategies, such as the National Health Workforce Volunteering Guideline of year 2020. And we are also actively engaged in policy and advocacy work, including being the Secretariat of the Non-State Actors Health Group and active in technical working groups of the Ministry of Health, as well as the COVID-19 pillar groups. Ladies and gentlemen, these are just some of our contributions in improving health and well-being of communities, achieved through engagement, collaboration, partnerships, and support from the different partners. Evidence, lessons learned, and best practices have been generated, used to inform more impactful intervention and scale up. We thus kindly request you to take time to visit our exhibition booth outside so that you can get some printed material and some more information for reference. Distinguished ladies and gentlemen, what I've simply shared is what the Foundation has been able to contribute to our health sector through partnership with our governments. But this is only a token of what could possibly be achieved if we can stretch our arms further to embrace the private sector. What we have done well so far with embracing the non-state actors and the faith-based organization should be an inspiration to seek to achieve more with the private sector. And this is the essence of this symposium today. It is why our two panels today will feature on two thematic areas, that is accelerating strategic health transformation in Tanzania through Business Coalition for Health, and also innovative public-private partnerships approaches towards attaining universal health coverage. Your Excellency, ladies and gentlemen, today we are witnessing traditional public health facilities are confronted by limited financial resources, complex social and behavioral problems, rapid disease transmission across national boundaries, such as COVID-19, and limited government capabilities to address them. At the same time, we see readiness of the private organizations and non-state actors to come forward to accept a broader view of social responsibility as part of their corporate mandate, including public health. It is our hope and expectation that this symposium will bridge our understanding on the need to work together and achieve together. Inspired by the late President Mkapa, the Benjamin Mkapa Foundation believes that public-private partnership is the best model for tackling large, complicated, and expensive public health problems. The time is now, the time is up. Let's rise to the occasion. I thank you so much for the attention.